This conference will now be recorded.
Welcome to the orientation class today. So today I'll be just giving you a little orientation about the EBCOG OSCE. That is a part 2 exam. You all must be knowing that EBCOG has got 2 exams, part 1 and part 2. Part 1 is like MRCOG part 2 and part 2 is clinical exam. So clinically it is a little different from MRCOG and it is easy than MRCOG. Okay, so how it is different and how the preparation has to be done. So coming to the like general structure of exam, there are 10 stations in the exam. Okay, and time allotted. So 1 minute time will be for reading and 11-minute time for doing. Like when you enter the like exam area, so there would be certain cubicles, and on the like outside the cubicle you will find one or two papers. Okay, what, so you have to read your task. Okay, and you can take pen and paper along with you also. And but they give only 1 minute for the reading. Okay, then there would be a bell, you have to go inside. Then there would be 11 minutes where you have to do your task. Okay, so 1 minute reading time and 11 minutes of your like uh, time where you have to perform your task. So out of this 10 station, one station is a preparatory station. That means you are doing preparation for the next task, but actively you are not doing so. If you think that actually you are actively performing only 9 stations. Okay, and so like in MRCOG we do have modules are there, and you will get all that one task from each module, and the marking is according to domains. And so that is a different scenario, but here the things are completely different. Here in APCOG there is no syllabus, there are no modules, and there are no domains. They just give you a brief that what kind of task would be there. So I'll just take you through this all task that would be there, and usually in the exam you will find them in a same way. So task number one is history taking and summarizing to the colleague. So in this station you have to take history, then you have to give brief summary of situation to the examiner, like as if you are doing handover. Now here in this situation there are two issues, like two ways. Either you can give your summary in SBAR pattern as we do for MRCOG, but like you can do any other way also, like you can just summarize the case. SBAR is not completely required there, because you can understand people, can you see slides?
Sir, no slide.
Yeah,
No, ma'am, not able to see the slides, ma'am.
now
Yes, ma'am.
now
It's
okay,
clear,
so
ma'am.
yeah, okay, fine. So again, this is an orientation about um, EBCOG OSCE Part 2 exam. Okay. Now, general structure of exam, as I've already discussed, that there would be 10 stations, 1 minute for reading time, and 10 minutes where you would be performing the task. There would be one preparatory station of 12 minutes. Okay. I'll be just giving you briefs of all 10 stations. So task number one, it would be history taking and summarizing to colleague. As I already told, that there would be a reading, there would be a scenario where you have to take detailed history. Now, it is a detailed history because 11 minutes, it is a too much time for history. But yes, the task will be to take history only. So in the MRCOG, we take relevant history. But in this particular task number one, you have to take detailed history, and the positive finding you have to summarize to your colleague. You can summarize in a way as bar, or you can just give some positive findings. And like in MRCOG we are rushing with the time, and there is so much of stress. But EBCOG is totally relaxing exam because time is more and you have to do less things. So in this history taking and summarize, you'll be able to do, if you go very slowly, then also you will be able to do it in a 9 minutes. So 2 minutes you will be like looking at each other only. So time management is, there is no problem in whole EBCOG exam. Time is not an issue. So task number one, now this task number one, you can get any scenario from gynecology, or you can get any scenario from obstetrics. So any patient they are giving, just take history and summarize it to your colleague. Now task, so next come the task number two. So task number two is a basic technical skill. Okay. Now this task is something that is unique to EBCOG, and this was not there in MRCOG. Okay, so here you will be given some simulator and you have to show technical procedure. Usually, like this exam is done at a place where there is a simulation center is there, so that you can show your technical skill on the simulator. Like last year it was in Portugal, and there was a very beautiful, you know uh, simulators there, and there you have to show your skill. And again, the time allotted is 1 minute outside and 11 minutes inside. Again, it is not a very difficult job, you'll be easily able to do. So it could be like anything from gynecology or from obstetric. So from gynecology, it could be either insertion of intrauterine device, or you have to perform diagnostic hysteroscopy, but you are doing hysteroscopy on a simulator. So as if you do in your hospitals hysteroscopy, same way you will find as simulators there. Okay, and usually the examiner would be there, who will guide you through that, about the buttons and about the all things, whatever the mechanical thing you ask. Okay, laparoscopic sterilization, last time it was laparoscopic sterilization. So it was all computerized feeded exam, system. So examiner uh, uh, you have to just introduce your this thing, camera. The ports are already there, you have to introduce your camera, and you have to if you want to if you want to do cautery, ask examiner you want monopolar cautery or bipolar cautery. He will provide you, you do go inside. Then once you have cauterized, then you want a scissor to cut the tube, then ask the examiner and he will give you scissor. Like everything is simulated. Actually he's not giving scissor, he's just doing some clicks, so the scissor is coming. So this way simulator is there. Okay, this is like live experience that what I am gone through, I am giving. And it could be topic. So those who have you are doing this on a regular basis, or have you have assisted that, so it is not a very difficult situation. But those people who are not doing laparoscopy, for them this they will find a little difficult. Okay, so the basic advice that I can give you, that please go to some of your colleagues who are doing laparoscopy and get oriented, assist few cases. You can like on the internet you can see videos, but that maneuvering instruments, hand-eye coordination, that is required. I'm not saying that the same is coming to you, but it can come, you have to get ready. Okay, they, there would be an USG machine and you have to do transvaginal USG. So yes, you have to know how you will hold a probe, how you will insert inside, and then automatically a picture will come on the screen. They have got big rooms, big simulators. So though it is a very wonderful experience, okay, it is enjoyable experience. So then the picture will come, then they will give you some instruction that you have to explain it to the patient or something like that. So it can come as a transvaginal USG, it can come as a transabdominal USG, it can come taking LBC or pap smear. The chances of this is quite slim. It could be as simple as Foley's catheterization. Now you can guys can understand that if you have to say something for about Foley's in 11 minutes, so difficult. So it requires though you are doing it on a regular basis, but it requires you know preparation. What you have to speak, it may be per speculum examination, per vaginal examination. So these are few of the things from the gynecology, but there is an endless list. So these are the few common that I have put. I'll be showing you one example of one also. So this basic technical skill, to pass this exam, this station has, you have to get clear pass. Okay, in their exam like MRCOG, there is no borderline or something. A basic technical skill everyone has to pass. Therefore, those who find hysteroscopy, laparoscopy difficult, please go and assist some cases. Though they will be asking very basic, very small procedures, but yes, how you are inserting that scope and looking at camera with your movements, they will assess that how much you know. Okay, and those who are have not doing USG, uh, like go and stand with your radiologist colleague at least for a few days, like 2 3 days. If you go there, you will or if you have a orientation of probe, there is no problem. Okay, so like that you have to learn it, because a laparoscopic sterilization, like I got, one of previous year person got transvaginal USG, another person previous year got a transabdominal USG. These we know, but anything can come. Please don't get afraid with this, because it is, I'm giving you an idea so that those of you have got any weak points, so you can correct itself. It is just going for 2 3 days to a colleague who are doing them, then you will be oriented and you'll be able to do in the exam. Okay, it could be basic task number 2, it could be basic technical skill obstetrics. What can come in obstetrics? That is quite easy, you everybody knows it. It could be instrumental birth, it could be external cephalic version, though no one has none of us has done version. But yes, doing video, you have to do it on a dummy, you'll be able to do it, not difficult. It could be abdominal examination, it could be tear repair, AP repair, or suction evacuation. So these are easy. Obstetrics is usually easy ones, okay, that you are doing on a routine basis. Now this will be the task number 2. Now coming to task number 3. Now task number 3 would be a preparatory station. That means there would be a cubicle and you are sitting alone there for 12 minutes, and you have to make PowerPoint. That means the PPT presentation that you make for your presentations. So they will give you a basic topic, so you have to make a presentation. There would be no internet access, and they want you to use 3 slides. So first slide will be your title slide, second slide you will just summarize what you are writing, what are the presentation points and third slide you just summarize the take home messages, and also you know you are just saying some thanks and all. So those people who are making this PowerPoint presentation on a regular basis, for them it is an you know uh, very easy, very easy. But those who are not making PowerPoints, so you guys have to kind of practice it, because timing because uh, typing and PowerPoint, what are the buttons you have to use on the on your computers, that you should know. Okay, but again it is very easy. And the topics could be any random topic. Like one time it has come, it can be vulvovaginal infections. One time it has come type of perineal laceration. Tocolytics, it came like, it was when I was there. So you have to prepare a talk for tocolytics, and they gave 11 minutes for the presentation. Though I make all that time I'm making presentations, but when I was doing with their computer, I found a little discomfort, because that I'm not using that the computer. So little haziness was there with my side also, but I was able to do, so everyone can do it. Okay, so you can practice it on a laptop, but there they give big screen like a computer screen, and keypad was different. It was not like Apple laptop what we are using. So one more time you can prepare with a big screen of your computer and keyboard separately, because this way it would be given. So whole 10 minutes, whole 11 minutes you are sitting alone and you are making presentation. So this is the your preparatory station, and like no marks, nothing, you are just sitting and making this. Now when you move to next cubicle, then you have to speak. So then they will ask you that this is a topic given. Now target or audiences, yeah, trainees and specialists in obs and gynae. So her, like you have to present the topic. So like you have to kind of, so there would be a very big room on a very big computer slide, um, very big screen. Your presentation is coming, and transferring your presentation from task number 3 computer to task number 4 computer will be done by the people they help you in transferring. Okay, but making part has to be done by you, and speaking also by you. So you're speaking, so like as if you take lectures for your students, okay, whatever. So prepare your topic so that you can speak for 8 minutes, because 2-3 minutes they will be asking question also. Again, time is not an issue, because you make a slide, make a presentation, and then you start speaking. Then you will see that 8 minutes are too big to keep on speaking. So time will not be an issue, but yes, it could be any random topic. But from ops and gynae, so whatever with your knowledge and template, you use that and make presentation. Now this is again unique to your uh, EBCOG exam. It is not there in MRCOG. Now coming to the task number 5. Task number 5 again very unique. So that is the complex technical skills and team working skills. So in this station, usually you will find a big room with monitors are there, with a patient is lying over a table with some kind of emergency, whatever the station they want to give, task they want to give you. You will find 2 3 4 people inside. Some of them will be nursing student, midwife, or your examiner and the patient family member, and they will simulate the situation, and you have to that kind of uh, you're a leader, and you have to take the manage that emergency, the, the way you do in your hospitals if any emergency is there. Okay, so this way, and after each step, like if you have done one step, second step they will provide you some findings also. Okay, they will provide you some findings also, then you have to move ahead. Like for example, I can give you like in a collapse complex technical skill station, when after 4 minutes, when like we asked for the rhythm, then they showed on us on a screen, and it was like asystole rhythm. So asystole, that means the compression will make no sense. Then that means, so they will say okay, now it is asystole. So you will say okay, I would like to do hysterotomy. So they will help you with this. Okay, so this way some information in between, if you ask for pulse and blood pressure, if you ask for any medication, I would like to give that. So this kind of information what you say they will provide. So this way it happens, and this is again unique to this EBCOG exam, and the people are little scared about it also. And yeah, but if you prepare in that way, then you'll be able to do it well also. And this is again the must station to pass in the EBCOG exam. So basic technical skill station and complex technical skill station, these are must to pass. Examples of it, not too many situations. It could be management of shoulder dystocia, They will give you a simulation and the shoulder is stuck. It could be management of your eclampsia. You will find a woman is having a fit. You go inside. It could be after a retention of after coming breach. Then you have to manage. It could be any PPH scenario. It could be any APH scenario. It could be rupture ectopic, emergency simulation, or it could be maternal collapse. So any these are the few basic scenarios or that they are coming. It is not out of the blue they're asking something, but yes, you those who are working in the hospital and take part in their mock drills and all, for them the things will be easy. For other people it will not be difficult, but yeah, you have to practice it in that way. Okay, so this is a basic practical skill involving your team working skills that is unique to this EBCOG exam and must to pass. Now coming to task number 6, this would be a teaching task. Teaching task we already know. Again, there would be a simulator or there would be a junior doctor, and that you have to show some technical procedure they will give, so that you have to teach. So teaching is like almost same of what we are doing your MRCOG. Okay, so examples it could be for teaching, it can be endless, but episiotomy repair, urinary catheterization, suction evacuation, intrauterine device insertion, knot tying, anything could be there. Okay, and in EBCOG exam, like they're not looking answers or everything, the ways of MRCOG, because they have that particular guidelines and all that strategy and their way of doing is not there. So in EBCOG exam, whatever the skill you want to show, say anything, you do according to your knowledge. And but yeah, it has to be some practice that is followed nicely. It is not that knot tying has to be RCOG video. It could be the way you do, but you have to explain kind. Okay, so this would be task number 3. Task number 7, you will find a difficult patient, like who is dissatisfied with some sort of clinical care. So so you have to deal with the situation in a sensitive and professional manner, address her concern, expectation, then sort of a satisfy management plan you have to make out. So what could be the difficult scenario? This could be similar to your part 3, the patient requesting for cesarean, patient requesting for induction of labor, patient refusing induction of labor, patient refusing cesarean section, patient wants her ovaries to be removed at a young age, patient wants sterilization at a young age. Some investigation has come, and she doesn't believe that, or she's like there is a conflict about it, and there's a conflict about management. Like I'm, for example, foot link breach is there. The management option, we know it is in cesarean section, then patient is adamant on vaginal. So this would be a sort of a conflict from the management. Then they are seeing your skills, that how you are taking of your difficult patient. So this kind of scenario could be there. Again, it could be anything from ops, it could be anything from gynae, because there are no modules. Okay, so this will be task number 7. Task number 8 will be again similar like your MRCOG. It will be breaking bad news. So like the aim of the station is to explain the result that has caused anxiety or suffering in a professional manner, and what will be the next step of management. Usually when you read the instructions, you will find that what they want. Okay, like for example, they will give you a scan finding of uh, uh, ovarian cancer or some histopathology. You have to kind of break the news and you have to make the management steps. Mostly in this kind of station, for example, they are checking for your new breaking bad news or something like that. They're not asking history to be taken. So even in their task, it is very well specified whether you have to take history or not, because in some of the station history taking was not there, and they wrote it very clearly that history taking is not required. So this is breaking bad news. You know the steps of breaking bad news from your MRCOG. Now, what could be the examples? It could be cancer diagnosis, it could be H-mole, it could be anomaly diagnosis, it could be stillbirth, it could be Down syndrome, it could be premature ovarian failure. So you have to follow your steps of the breaking bad news that we already know, and you have to kind of explain the management. So this is easy task. Okay, again, there are no modules, so topic could be from gynae or ops, any subject. Coming to task number 9, now this would be again important task, but this kind we do practice in MRCOG, but we do a less. So actually in this station there would be an examiner and you will be there, and they will give you some like incident has happened, then how you will manage that, like so the, and how, what will be, how would you manage, what would be consequences of that incident, how you what will be your follow plan, and how you will prevent same incident to happen in the future. So this would be your risk management station. This is must to come, and like yeah, it requires a lot more knowledge from what we used to do in MRCOG. Okay, so this will be yeah, this requires preparation again, because usually they will give you a scenario and it is kind of like 10 minutes you are speaking and keep on speaking only, and the examiner is marking and you are speaking. Sometime usually prompts are not there, but sometime if important thing you have missed, they kind of prompt also. Again, time will not be an issue. And examples could be for task number 9, like never event, serious incident reporting, wrong medication, exchange of results, any post-op complication, and post complication due to mistreatment. So anything could be there. Now, last station, it would be like explaining the clinical situation and making a shared management plan. So here again, the role player would be there. So there would be a clinical scenario. So you have to explain the condition to her, that she's having stress urinary incontinence, or that she's having urge urinary continence, and you have to, or she's having prolapse, or you have to kind of give the option management, then like whatever she's happy with, kind of thing. So shared management plan, it is again the same way we do in MRCOG. Okay, so these are the like take through go through of all 10 tasks in the exam, and so yeah, this way it is done. So it is easy exam because time is not an issue at all. You can read very easily. That would not be an issue. And it is but the new stations here are uh, like your basic practical skill and complex technical skill and PowerPoint presentation and risk management. These are kind of new scenarios. These are unique to EBCOG only, and out of which, they do have a marking system, but basic and complex skills has to be passed by every students. I think rest all other how the marking is done, I'm not very clear of. Okay, so this is the overview of exam, and anyone of you have got question till now?
Hello.
Okay, yes,
Yeah, ma'am.
yes,
So the sequence, yes, ma'am. The sequence remains the same as you said, ma'am.
yes,
1, 2, 3, 4,
yes,
or
yes, yes,
there's switching
yes.
of stations like MRCOG.
No, this is same, this is almost same.
Okay, okay, ma'am. And ma'am,
This is,
from the base, yes, ma'am. And from the basic technical skills and complex technical skills, only one OBS or gynae will come, or both will come, ma'am. Only one station will come.
no, 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 one will come.
Out of OBS and gynae, one will come.
Yes, one will come.
Okay, ma'am. Okay.
Yeah. So now task number 2, though I have already explained, examples could be diagnosis of heredity for mole, placenta previa, urinary incontinence, prolapse, infertility results. So whatever the kind of situation they have given, you have to explain it and you have to come up to a shared management plan. Okay. Now I have just make small presentation of basic technical skill, one ops and one gynae. Let me go through it. So basic or technical skill that I have chosen is obstetric examination, and it is the most basic. When the first uh, when we started our ops and gynae in MBBS, then we started with this. But yes, it is 11 minutes, so you have to speak, making respect, dignity to dignity of the patient, and you have to kind of show. Okay, so it is very basic. So like for example, obstetric examination. So first part will be like you have to introduce yourself. You confirm the patient's name, date and birth. You have to briefly explain what you are going to do in the examination using patient friendly language. You have to gain consent that, yeah, are you okay to go ahead with? I would like to call for a chaperone. Then provide the patient opportunity. Like in the obstetric, usually we ask them to pass urine before examination, and exposing the patient from pubic symphysis to Xiphus sternum, making it sure that the rest of the body is covered, making dignity, and then ask the patient whether she has any pain or anything before you proceed with the examination. Then make it sure that your equipments are there. So this will be sort of an introduction. Then we know that how many part of examination is there. So first part will be positioning of the patient. So it should be like a supine position, and arms can be alongside. There could be little tilt and head is supported. Okay. So next step would be inspection. We already know what you have to see in a inspection. So abdominal inspection, you would look for, that abdomen, like the shape of the abdomen, and whether it is like how much it is distended is corresponding to pregnancy or not, that so then you will see a linea nigra, stria. Then you will see whether any surgical scars are there, any pulsations are there. You would inspect for the fetal movement, and you will inspect for any kind of hernia. So this after inspection, so what will be the next part? We know that it would be the palpation. So in the palpation, what you will do? Palpation first will be, you'll be just kind of measuring symphysiofundal height. So and then you have to do grips. So in the grips, you have to find out, assess the fetal lie, fetal presentation and engagement. So very basic. So this is the way you already know it, measuring the measuring the symphysiofundal height, but you have to kind of speak every word, every step of yours, and you have to do it. So though it is very basic, but yes, you have to show it, because understand, you have got 11 minutes for it. So this is, you have to palpate the upper border of uterus like this. Then you will maintain, find out the symphysis pubis, and you usually then measure this. This is measuring of symphysiofundal height, and in centimeters it usually corresponds to size of pregnancy, number of weeks. Okay. So some fundal height measurement is done. Then you will move to like grapes. This you have to speak and show, and there would be a mannequin. So making it sure your hands are clearly washed, and you have put the sanitizer and your hands are warm and the patient is happy to go ahead with it. Then you put your both hands facing towards the pregnant woman. So you're looking at the face of the woman. Then you palpate the upper abdomen by putting on the hands on the top. This you already know this way. Then this help is to find out that upper pole of the uterus, whether it is head is there or small part this is there. So this is first maneuver, that is a fundal grip. Then you move to the second maneuver, that is the lateral grip or umbilical grip. Usually helps to find out the lie. So again, in this maneuver, you are looking at the face of the patient. Okay, you are looking at the face of patient. Apply a deep pressure with one palm of hand on one side, whether other side of the you are just palpating. Okay, so this can be with the deep palpation on the right side, you find out what is there, whether their soft knobby fetal parts are there, and on the other side, doing the similar manner, you will find out whether there is a green, whether the fetal back is there. So fetal back will be smooth and firm, and the extremities or fetal like will be feel like small irregularities. Okay, so this way the umbilical grip or the lateral grip is done, helps to find out this way the lie. Then there would be a first pelvic grip. In first pelvic grip, again, you are looking at the face of patient and your fingers are pointing towards the patient face only. So you will extend your hand, that your thumb and the four fingers, that usually lies in an extended manner over the symphysis pubis. Then you kind of you'll be able to find out with this grip whether what is there in what is a presenting part. So whether it is cephalic head is there, or whether breech is there, or if it is like empty. This will be empty in, you already know, in the transverse or oblique presentation. Okay, so you are doing it at every step and you're speaking it also. Then second pelvic grip, that this is the grip where your friend, you will be looking at towards the face of the patient. Okay, sorry, this is the last grip, only grip where you look towards the woman feet of the patient. Then you mm, finger of the both hands are present, are like put above the iliac crest like this. Then you try to find out whether your fingers of the both hands are approximating or not. If it is approximating, that means the head is ballotable, and if you are unable to approximate, that means the head is engaged. So this way you are able to find out. So this way you are able to find out whether the fetal part is engaged or not. So this would be the uh, grips, they help in palpation, so that you are able to find out fetal lie, presentation and engagement. Then last, what will be the last part? You will listen to the fetal heart to find out it can be with the peanut, or it could be with the Doppler or the stethoscope. So now this way we are doing obstetric examination. So this all what I have spoken, you have to do, speak it, and you have to kind of perform it. And to complete the examination, after your examination is done, you have to tell the patient that it is done. You have to thank you patient for their time. You have to summarize the finding. Then if any other assessment you would like to add according to the scenario given, that you can say. So this way the basic technical skill of obstetric examination is done, that they would be giving some mannequin, and also they may give you some scenario, that this way you have to kind of practice and you have to do in 11 minutes time. Any question with this? This is an example of basic technical skill and obstetrics. Any question? Any question? Okay. I'll be just giving you one more example. There is a basic technical skill, gynae examination. So now gynae examination, like what a gynecologist do in 2 seconds, now you have to elaborate and speak it and show it in 11 minutes. So first what you will do, you will introduce yourself, then you will confirm the patient name and date of birth, identity of the patient. What you will do, that you are going to look at her, you are going to palpate, whatever. Okay, then patient bladder to be empty. You ask the patient that there is any possibility of pregnancy, you have to rule out that. You have to gain consent whether she is ready for it. Offer a chaperone to her, and ask whether she has got any discomfort before you proceed with the clinical examination. Then you will ask very gently that patient should remove undercloth for examination, and you have to provide them privacy while they are getting undressed, and yeah, their privacy and dignity has to be maintained. So this will be kind of your per vaginal examination introduction. Then you'll say then first start with the pelvic inspection. So position of the patient would be modified lithotomy position. Meaning you have to do the inspection of vulva. So what you will see, you will check for any scar, any erythema, any discharge, any bleeding, any rash, any vesicle, or any other skin conditions are there. And then you ask the woman to cuff because you want to see whether there is a leak on cuff is present or not. So this would be the part of your vulval inspection. Now coming to the per vaginal examination. So again, you have to ask the patient whether she is okay to go ahead with it. Then you have to kind of do the palpation of vaginal walls and the fornices. Then bimanual examination for uterus and adnexa. Then you withdraw your finger to see whether any discharge is there, abnormal discharge, or the blood is there. Then you have to recover the patient and say examination is complete. So this is the complete examination, but I'll show you in how to you do it in a stepwise manner. So first of all, in vaginal examination, you like after your patient, you have consented, chaperone is offered, and she's given consent. Then you just you have just like sanitize, worn gloves, sanitize yourself. So very you separate the labia and with a lubricating gel inside, you gently put two finger inside. Then this when you go in, so assess the vagina, for any masses, any lumps, whatever. Then assess the cervix for any growth or any the texture. Okay, so this will be the first part of palpation. Then you do the you'll keep one finger to one hand over the patient abdomen, and two fingers is inside the vagina only. Then you do the bimanual palpation to find out the uterus, size of the uterus, shape of the uterus, mobility of the uterus, and tenderness. Okay, so this you are looking for in the uterus. After that, you move your finger to one side of the abdomen, right side, and you do bimanual palpation to check for the adnexa. Usually, to find out if there is adnexal masses is there, or any ovarian cyst and mass. Okay, because usually normal ovaries, we know already that we are unable to find out. So you palpate for it for the adnexa. Now this PV we are doing in 1 minute time, but when we it comes in speaking, you have to follow all basic things. Then last will be, now after the palpation is done, what you withdraw your finger. So whenever you withdraw your finger, always inspect whether any blood is there or normal discharge is there on your fingers. After that, you recover the patient and you will ask the patient that examination is complete. So this way per vaginal examination is done. I have not introduced per speculum part here because I have kept it till the bimanual, with a basic per vaginal examination only. Then to complete the examination, you will thank the patient. You will summarize the finding, and according to the findings and the scenario, you can ask for some tests such as urine or speculum or swabs or USG or abdominal examination, whatever. So this way you have to. This is an example simulation for basic technical skill, that is the gynae examination. That's all I had to say today. So that's all. So all the best for achieving your dreams. So this is me here at the Particle Exam Center. So yeah, so all the best for you guys. Any questions you can ask me. Any questions, anyone?
No questions, ma'am. Thank you so much.
Doctor, just I have a quick question. So this approach on examination is the same for MRCBI?
No, that is totally different exam. This is orientation about EBCOG,
Yeah,
EBCOG.
yeah. But I mean examination, like abdominal, vaginal examination, obstetric and gyne is the same as for MRCBR.
See, I'm not aware of the MRCPA examination, so I won't be able to compare them.
Okay.
Okay, all the best, people. Bye.
Okay, thank you.
Thank you, ma'am.
Welcome.